Hi, my name is Hillary Walker and I am an acute care therapist here at Island Hospital. If you are watching this video, you and your orthopedic surgeon have most likely determined that surgery is the right choice for you. Today I would like to share with you the essential things you can do before and after surgery to promote a successful outcome. I will also walk you through what you can expect during your hospital stay. First, we will discuss how to prepare ahead of time to ensure a smooth surgery and recovery. The most common equipment need for the orthopedic surgery patient is a front-wheeled walker. To be sure the walker you will be using is the correct fit for you, stand inside of your walker and be sure it will adjust so that the handles of the walker touch your wrists in the area where you would wear a watch. We will double check your walker in the hospital to be sure it is the correct fit. The one exception is if you are planning to have a total shoulder replacement. In this case, you may need a cane, which can be sized in the same way. Other common equipment needs are a bedside commode or raised toilet seat with a splash guard, and a shower chair or a tub transfer bench. At the end of the video, we will provide information on where to find durable medical equipment to borrow or rent in the area close to you. When preparing your home, it is best to set up a living space all on one level, if possible. Be sure there is adequate lighting, especially at night. Install railings on any necessary stairs and grab bars in the shower, if possible. Remove all throw rugs or other possible trip hazards, such as extension cords. Keep in mind that pets can be trip hazards as well, so try to set up a barrier if you have a pet that likes to get underfoot. Move your most frequently used items to an easy reach level. Do a trial walk around your home with your front-wheeled walker to be sure there is adequate space for a walker to fit. Measure the heights of the toilet, the bed, recliner, etc. so a therapist can advise you of any helpful adaptations. For many, it's easiest and most comfortable to exit the bed on your surgical side. Those having a total shoulder replacement may opt to sleep in a recliner. And most importantly, identify a helper or a caregiver. There are some essential items that we will want you to bring with you to the hospital. Planning ahead will ensure your stay is most efficient. Please bring with you comfortable, loose-fitting clothing and supportive walking shoes, your walker or cane, the measurements of your home surfaces, your helper or caregiver. It's very helpful to have whoever will be assisting you at the hospital with you as much as possible to work with therapy, discuss any concerns with our staff, and to receive all discharge instructions. Bring a copy of your advance directive and/or post form. If you do not have these forms, we can provide them for you here and scan them into your medical records. Ask your doctor or contact Island Hospital to see if they would like you to have these forms ahead of time. Bring a copy of your home medication list, including prescription drugs and over-the-counter medicines such as vitamins and supplements. Write down any questions you may have and bring them with you to the hospital. It is important to schedule your follow-up physical therapy appointment before your surgery if your plan is to go home with outpatient physical therapy. If you are having a total knee replacement, plan to see a physical therapist approximately 3 to 4 days after your discharge date, about 5 days after your surgery date. Those having a total hip replacement should plan to see a physical therapist within 1 week after your discharge date, about 10 days after your surgery date. Patients having a total shoulder, back, or neck surgery will be given exercises in the hospital and usually wait until their follow-up appointment in their doctor's office, approximately 10 to 14 days after the surgery, before starting any continued physical therapy. Next, we will discuss what to expect when you are in the hospital. The anticipated length of stay for orthopedic surgery patients is generally 1 to 3 days. On the day of your surgery, don't be surprised to have some tubes attached to you, such as oxygen, a catheter to collect urine, a hemovac, which is a drain that helps with post-op swelling by draining blood from the surgical site. You may also have IV fluids and antibiotics. You will meet a physical and/or occupational therapist like me shortly after surgery. The first goal of your therapist while you are in the hospital is to get you up and moving, as tolerated. We will teach you how to use your adaptive equipment and assure that your walker is the correct height. To aid in your recovery and to restore your strength and mobility, your therapist will supervise some post-operative exercises. At the end of this video, we will provide information about where you can find a list of specific exercises that you will be given in the hospital. While you are in the hospital, your therapist will help you be as independent as possible with all your activities of daily living, or ADLs, and assess any needs for home equipment. In addition, your therapist will provide training to your family or caregiver and assist with discharge planning.
Hi, my name is Carla Smith. I am a social worker in the Care Management Department at Island Hospital. The primary role of the staff in the Care Management Department is to assess patients' discharge needs and assist patients to develop a safe discharge plan. During your stay at Island Hospital, a social worker or nurse from the Care Management Department will see you to assess your needs and assist you with your safe discharge. If you are having a planned surgery, it is important for you to have a discharge plan A and a discharge plan B. It is important to have a backup plan as your needs can change after your surgery while you are in the hospital. Here are a few examples of safe discharge plans. For patients discharging to home and who are in need of home care services, including personal care, housekeeping, bathing, cooking, and grocery shopping, a nurse or social worker from the Care Management Department can provide you with resources to assist you with finding a private caregiver. These services are typically not covered by health plans. Patients should know that skilled nursing facility placements are not automatically authorized just because the benefit is listed as covered under your medical insurance policy. You must qualify under your insurance company's guidelines. The insurance company will review any progress notes from your surgeon and notes from therapy before an authorization will be made for a skilled nursing facility placement. Home health provides nursing and therapy services in your home. Most insurance companies require patients be homebound to authorize home health services. Homebound status means that you are unable to leave your residence for outpatient therapy. Outpatient therapy is the most common discharge plan for most surgeries, including planned orthopedic surgeries. Included in the surgeon's instruction should be the frequency and duration of the outpatient therapy treatment. If you are having a planned surgery, your discharge options should be discussed with your surgeon at your pre-surgery appointment. Always keep in mind circumstances change in healthcare, and that is why we encourage you to have your discharge plan A and your discharge plan B in place prior to your surgery. We look forward to meeting you during your stay at Island Hospital.
Thank you for choosing Island Hospital and for taking the time to watch this video to be well prepared for your upcoming surgery. For information on where to find durable medical equipment, physical therapy clinics, and a list of exercises, visit the physical therapy page on the Island Hospital website at www.islandhospital.org.